right, so the next question is, what are the common mistakes parents make when their child or children are having nosebleed?
One of the commonest mistakes is panic. That will worsen the entire situation. The other things is stuffing things in the nose, making the child lie down, ask the child to swallow the blood, putting anything hot around the nose. All right, these are common mistakes that the parents make that we
Okay,
should avoid.
thank you. Can nosebleeds be a sign of an underlying medical problem?
Yes, of course. Even in children, nosebleed can just be a sign of a more serious problem in this case, especially if there are other symptoms. They bruise easily, they bleed under the skin easily, bleeding from other parts of their body, easily bleed from punctured sites and injured sites without it stopping or resolving. That's prolonged bleeding from these sites. Bleeding from the teeth or gums regularly during brushing. These are sinister signs that you should worry about if your child is having nosebleeds and having these things in association.
Thank you very much, babe. All right, so how can parents prevent frequent nosebleeds at home?
Well, the commonest cause I mentioned is trauma, finger picking, nose picking. So you can always tell your children not to pick their nose because their fingers are so tiny and small and they can easily bruise that front part of the nose where the blood majorly comes out from because blood vessels there are very fragile. So don't pick your nose, no fingers in your nose, no forceful blowing of your nose. If you have a cold, retreat, just ensure that the lining of the nose doesn't get too dry during very dry seasons where we expect desiccation of those linings of the nose. We can easily put lubricants, something as common as Vaseline, to make sure that it is moist, can significantly prevent nosebleeds in children.
Thank you, Danny. I know you've already answered this question before, but I just want you to re-emphasize it. At what point should a child who is bleeding from the nose be taken to the hospital?
Well, if bleeding becomes recurrent, having 3 or more episodes in a week, then it's a sign that it needs medical attention. If bleeding is not stopping even after 10 minutes of applying this first aid that I mentioned, then the child should get to the hospital as early as possible. If there are other symptoms or signs associated with nosebleeds, like I mentioned, bleeding from other parts of the body, prolonged bleeding from injured or punctured sites, bleeding under the skin, bleeding into the eyes, bleeding from the mouth, bleeding generally from other parts of the body, then you should expect that this child needs medical attention. When your child constantly bleeds from the gums or teeth during brushing non-stop, there may be something more sinister than just the nosebleed.
Thank you very much. Thank you, sweetheart, for coming. Parents, nosebleeds are not always dangerous, but knowing what to do, when to act, and how to act is the key in managing children with nosebleeds or preventing nosebleeds from happening. Thank you once again for giving us your listening ear. Have a nice day. Please don't stop following us on Talk Child Health with Dr. Q Merita. Don't stop liking, don't stop sharing, tell your friends, and keep a date with us for the next episode. Thank you and have a nice day. Bye.